Well, thank you, Stefan, for the kind invitation, and thanks everyone for attending. Yes, like as Stefan said, my background is in epidemiology. I'm an evolutionary biologist myself, so it's quite a different experience for me to attend this talk, but hopefully I should be able to give you a different perspective on the pandemic and the role of religious communities that played, in this case, of the Iranian epidemic and its significance. So just to give you a very brief overview of where we are with the pandemic, we are very much, the numbers do indicate that we are very much in the middle of the pandemic. The cases are still growing across the world, and the number of deaths, daily deaths, are quite substantially high, although some of the Western countries, thanks to high rates of vaccination, have been able to ease some of the restriction. Nevertheless, at the global scale, the number are still staggeringly high. I will be focusing on that region in the yellow circle, Iran, and in particular the province and city of Qom, which is the religious capital of Iran, and it's just south of Tehran, the capital of the country. So just a very brief overview of the importance of Qom. It's like I said, the religious capital. It's the focal center of the Shia Muslim faith, and it has the largest madrasa, or theological college, and has several holy sites, including the Fatima Shrine. Has a relatively large population size of over 1.5 million residents, and a relatively large population of clerics as well, with over 50,000. I checked the numbers. This is from a few years ago, and the number seems to be growing since then. And yes, it has, like I said, a close proximity to Tehran, which is the capital, with over 10 million people, and some of the other major cities across the country. Just before I delve into the actual dynamics of the epidemic spread in Iran, very, again, brief overview of what we mean by an epidemic spread of a pathogen, in this case virus, called SARS-CoV-2, which is responsible for COVID-19, is that generally once you have an infectious individual within a population, your majority of the population is susceptible to that pathogen or virus. I don't know if you can see the cursor of the mouse. Yes, looks like you can. So the majority of the individuals are susceptible, meaning they can catch the virus. And as the number of infectious individuals gradually grow, the virus transmits, depending on how good it is in transmitting, the pool of susceptibles gradually drop. And as a result of that, some individuals might recover, some might sadly die. But over time, you would see gradually the virus would run out of infecting more people. There will be fewer susceptible individuals in the population, and the epidemic would die out. Now, in the case of COVID-19, you're quite familiar with seeing these sort of curves on TV and elsewhere that, sadly we would see multiple of such waves because these pool of susceptibles will be pumped back up again into the population because of waning immunity, lack of vaccination, emergence of variants of COVID, which would then result in multiple waves over time. Now, when this key parameter, which again you might have heard on TV and in various places, perhaps if you've been following COVID news, is this basic reproduction number, which usually is measured at the beginning of the pandemic or beginning of an epidemic, which effectively measures for every individual who recovers how many new infections emerge. So if R naught is 2, that means for every individual who recovers, 2 more people get infected. So the epidemic would essentially grow double every generation. Whereas the idea or the hope is if you introduce restrictions, any sort of restrictions which you are again familiar with, like masks, wearing masks, social distancing, more stricter measures like lockdowns, you would be hoping to break up these chains of transmission and effectively reducing R naught, which would then result in having fewer cases. Now, if this key parameter R naught is below 1, means for every individual who recovers, fewer than 1 individuals become infectious. That means the epidemic would shrink. So by being able to push the R naught below 1, you would be able to reduce the sort of burden of the disease in the population. And we had experienced, different countries took different measures. So on the left, you're seeing this dynamics of R naught. Well, its a technical term for it is RT, which is measured over time. It's effective reproduction over space. It's the same idea, measured over time, where you could see that in China, in this case, during the first 3 months since the start of the pandemic, the R naught was quite high, a little over 3. But then as we introduce more restrictions, interventions, like quarantining, lockdown, as of like mid-February 2020, basically the reproduction number was below 1, which led to the stopping of spread of disease essentially from March onward. And on the right, you see various different interventions that were taken in Europe, like self-isolation, social distancing, public events being banned, school closures, and in many countries, again, lockdowns being introduced. And they all have various levels of effectiveness in reducing R naught. Basically, these are measures, these are the interventions that we take in order to reduce the spread. And so going back to the dynamics of the spread in Iran, Iran was actually one of the first countries outside mainland China to experience a massive wave. And interestingly, from a epidemiological point of view, it actually seeded a lot of outbreaks in other regional countries, not just in the Middle East, but also around the world. So in fact, the first cases in New Zealand were from Iran, and many cases in the States, Canada, Australia, all sorts of places, even UK as well, were from Iran. And so from individuals who had a recent travel to Iran, went back to their home countries, had their virus sampled, and from that information, we were actually able to reconstruct the original dynamics of the spread in Iran in one of the works, which I believe Stefan also collaborated with us. But also looking at mobility data, sort of air travel data. This is another source of information that you can use to assess the burden of the disease. Again, Iran actually seeded, exported basically cases to many regional countries like Lebanon, UAE, Oman, Kuwait, but also back to China in early March. So this all suggests that I have to remind you that at the time Iran was reporting very few cases, but at the same time we were seeing a lot of these cases actually being exported, suggesting that the outbreak is actually probably much larger than we think it is. So this is just showing you a plot of what the dynamics of the spread number of cases look like. During the first year, we had the first numbers of cases being reported in late February, and right around this time, 2 years ago, mid to late March, it was a Persian New Year, Nowruz celebration. There was like a lot of movement across the population, which led to the spread of disease. But then we had the first lockdown, so number of cases started to decrease. We had this relaxation or return back to normal, which led to another wave, and so on and so forth. And since then, I think we've had so far 6 waves of epidemic. It's the same pattern that we've seen in many countries as well. So just by knowing the reported number of cases, we were able to reconstruct the early spread dynamics. So as you can see, this is, like I said, the very first time point or very first day that Iran reported cases were 2 cases in Qom. So that's the yellow part over there. That's where our story begins really with Qom and its importance. So 2 cases were reported in Qom, and the same day those 2 individuals sadly died. But I'm going to just play this video now of how the virus spread, at least according to the number of confirmed cases to the people who had a positive PCR. And as you can see, it basically exploded across the country in a very short time span. Almost all provinces had at least 1 confirmed case. But more importantly, I want you to pay attention to Qom. So again, obviously, the size of the circles represent the number of cases. So Tehran is the biggest, with the most number of residents, so that the circle is much bigger for Tehran, but nevertheless the incidence, the per capita rate of cases were quite significant in Qom and basically in the central north part of Iran in general. And on 18th of March, basically the Ministry of Health of Iran stopped releasing province-level data, so we just couldn't understand what was happening. Nevertheless, this very short 1.5, almost 1 month worth of data did indicate that the epidemic likely started in Qom and actually very rapidly grew. The fact that 2 people died on the same day that the first cases were reported does suggest that at least the actual epidemic started at least a couple of weeks ago. We know it would take roughly between 2 to 3 weeks from onset of symptoms to an individual passing from COVID. So we would expect that the epidemic largely started a couple of weeks earlier, at least. So what we did basically was to leverage this other key epidemiological parameter called excess mortality. So this is looking at every possible death that happened within a time window in any province or in any region, so over time. So this is the excess mortality data going from late December 2019 to late 21. This is for the province of Qom. I'm just showing you a few other examples, but what I want you to pay attention to is this massive peak, sharp peak in excess mortality. Like I said, this is like a proxy for measuring the severity of the disease in a region. And the reason why it's so important is because, when the first 2 cases were reported in Qom was 19th of February, is right around the peak, actually. So it's right around the worst phase of the epidemic, basically, it was when the first cases were reported. So we really missed that key window of the earliest stages of the epidemic wave, which turned out to be in early January, that it was really growing. And as you can see, there were a few other provinces like Golestan that also experienced the wave during this same period, although Qom was likely actually the earliest. There were other provinces that did not actually experience much of a significant wave in that period, but experienced a wave at a later date. Now, the question that we really wanted to answer was, okay, how did the outbreak start in Qom? What was the factors that influenced the epidemic in Qom to be such a major wave? And, it's a very difficult question from an epidemiological point of view to point, to one or another cause, and you would really need to have good quality data to do that. And we did not have such data. Nevertheless, you could come up with some scenarios. So one of them, likelier ones, I'm just mentioning here 3 of them, was that there was like these merchants or hospitality workers who frequently traveled back and forth from and to China. It could have also been that an individual who got infected from another province, an unknown province, brought the disease to Qom, which led to the outbreak. Or the third option, which I'm highlighting in red and was also raised by the Ministry of Health, was these students studying in China and also missionaries. So clerics who were training in Qom and then were sent to China to spread the message of Shia Islam, basically, and then returning back to Qom. So it was actually mentioned that this was one of the very likely routes for the virus to be imported to the country. And again, like trying to understand, okay, what led to this harsh experience of COVID in Qom. On 20th of February, so this is the day after the first cases were reported in Qom, the Ministry of Health asked the governor of Qom to limit the number of pilgrims at the Fatima Shrine and other religious sites, to which then the head of Fatima Shrine replied by encouraging people to say, we consider this holy shrine to be a place of healing, so everyone should feel free to attend. They did not close the shrines nor any of the mosques. So mind you, again, reminding you of that picture of that sharp peak, 20th of February was right at the peak, right at this, massive surge of cases in Qom. So it was the timing of this, just wanted to emphasize and highlight the key importance of that, and the lack of communication really between the government and the leaders of the religious leaders in Qom about this. And so later on, like I said, there was this first lockdown in mid-March, and at the time the government said all mosques and all basically holy sites and shrines should be closed. I mean, the previous speakers also talked about this similar challenge for the Catholic faith, people who practice the Catholic faith. It was similar to the people in Iran as well, where the government, the governor of Qom basically said that the mosque should be closed, and this announcement was followed by a very large protest in front of the Fatima shrine. In fact, I might have a few pictures of the demonstrators there. So it didn't go down well with the people there. And in fact, wanted to show the video. I couldn't find it on YouTube, but these protesters later actually broke in to the Fatima shrine and went there and protested inside the shrine despite the restrictions being in place. So again, just an example of a lack of communication between the religious leaders who were saying one thing and the government and the Ministry of Health saying another thing. And in the meantime, a lot of people sadly getting hospitalized and dying of the virus. So later, I was trying to think of a nice ending for this story, but really, it's really just at the end of the day, some compromise from the religious leaders and some compromise perhaps from the ministry that they said, okay, let's try and think of a solution here, and decided at the end to nevertheless keep the mosques open and do some sanitary work, reduce the number of pilgrims there. And mind you, there is quite a significant number of pilgrims visiting Qom every year. It's like almost 20 million people, so it's like almost 20 times the population of the country commutes there. So that could actually be a very important source for spreading the virus. So this it could lead to significant super spreading events as well. Nevertheless, there was some compromise there, and also the fact that there was this sadly massive deaths made people realize the gravity of the pandemic, that gradually things improved. And the masks were introduced, and moving forward, even you could see the picture of the imams in the Friday prayers also wearing masks, and the numbers were reduced. So there was some compromise there at the end, and at the same time trying to maintain some of these practices open. But I hopefully wanted to just highlight this importance of communication, especially right at the middle of the pandemic, right at the time when the number of cases were growing significantly over time. And that timing is quite crucial when you're dealing with a very transmissible virus, and hopefully taking an action in time really can have a huge impact to the life of people. And with that, thank you for your attention. Happy to answer any questions. Thank you.